Hi, I'm Leon Lovelace, and this is the Unstoppable Force. Okay, I have a news story here from the Huffington Post about STD rates are at an all-time high right now in the United States. Okay, the U.S. is backsliding on progress against sexually transmitted infections, according to a new report from the U.S. Centers of Disease Control and Prevention. Rates of chlamydia, gonorrhea, and syphilis reach an unprecedented high nationwide. Our rates of congenital syphilis, when a pregnant woman passes infection on to her baby, also increased. This is the second year in a row that these three STDs have increased. And experts say the all-time highs reflect nationwide disinvestment in public health, specifically STD prevention. There were 1.5 million cases of chlamydia reported in 2015, a 6% increase from 2014. At 395,000 cases, gonorrhea is up 13% from 2014, and at 24,000 cases, syphilis is up 19% from 2014. Young people ages 15 to 24 make up about two-thirds of all chlamydia cases and half of all diagnoses for gonorrhea. Gay and bisexual men make up the majority of syphilis cases. Cases of congenital syphilis, which can result in pregnancy loss, as well as bone deformations, blindness, and deafness in newborns have increased by 6%. All these conditions are preventable with safer sex measures like monogamous sexual relationships and condom use. While they're also all generally curable with antibiotics, they may not be for long. Rising rates of antibiotic resistance mean that doctors around the world are finding it more difficult to find effective treatment. STDs that go undiagnosed or untreated can lead to infertility, chronic pain, and increased risk for HIV, according to the CDC. Trouble with spotting these bacterial infections is that they can be symptomless or have symptoms like strange discharge, burning during urination, sores or pain that can be mistaken for other conditions. This makes regular screening an important part of STD prevention. The increase in STD rates is directly attributable to a decrease in funding for health clinics that could screen and treat people, as opposed to any recent change in sexual behavior among certain demographic groups, says Dr. Jeffrey Klossner, HIV and infectious disease expert at the UCLA School of Medicine and Public Health. Historically, when we've invested in prevention and control, we've been able to greatly reduce infections, said Klossner. Per capita public health spending has been declining since 2008, according to a 2015 analysis. After adjusting for inflation, researchers found that per capita public health spending rose from $39 in 1960 to $281 in 2008. Since then, spending has fallen 9.3%. The CDC has also identified budget cuts to state and local health clinics as a major factor in the high rates of STDs. In 2012, budgets were cut for 52% of state and local STD programs, which means fewer people could get STD screening or treatment. That same year, 21 local STD clinics closed. So like they said, whenever you reduce spending in certain areas like healthcare, what you're going to expect, or what you should expect to see, is all of a sudden some health problems are going to start increasing because we're not having enough money in the system to prevent those problems. So when they stop spending in the local level for STD preventions, of course, the STD rates are going to rise. So we actually need to start, investing more in the people, investing in healthcare, education and other forms of government programs, so the people could be prevented from getting any preventable STDs or any other preventable health problems that we really need to just get rid of. So then what you could do as a viewer is, if you haven't gotten a STD check in a few years, if you haven't gotten one at all because you're young, maybe you're 20 or 21, what you should do is just go to your local clinic or whichever healthcare service you have close to you. Just get checked, because you really got to make sure that you're staying safe. If you have something, just make sure you get it treated as soon as possible, because you don't want to, even though you might be scared, I understand, everybody gets scared of stuff like this, but being scared and not getting tested can lead to more dramatic and disastrous effects to your health than just going and getting checked even though you're scared. So just make sure you just go and get checked. make sure you stay protected when you have sex, so we can make sure we could prevent as many of the preventable causes of STD rates rising as we can. And then you also need to, of course, try to vote in whichever politicians are actually going to increase the spending for healthcare, education, and so on and so forth, so we could prevent as many negative effects from, these things as we can. All right, so thanks for watching, and check out one of my next videos.